those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency, and we are servicing Palm Beach County, Broward, and Miami-Dade. Our number is 954-717-7027. I'm your host, Louise Gomez. Welcome to the show. I'm excited to introduce everybody to Dr. Camysha Wright. She is an ENT, ear, nose, and throat specialist, right here locally in Plantation. The address is 201 Northwest 82nd Avenue, Suite 404. And the zip code in Plantation is 33324. Phone number is 954-368-8519. Her website is www.thewright, W-R-I-G-H-T, thewrightent.com. And the email, if you want to email, you can email over to pmillevoi@entaaf.com. Thank you so much, Dr. Wright, for joining us today.
Thank you so much for inviting me. I'm so excited.
I'm excited to have you here, and I have so many questions because I see that you wrote this amazing book, Breathe Easy.
Breathe Easy, yes.
And so it can be purchased on Amazon, is that right?
Absolutely.
Okay.
And we have hardback, we have the paperback as well as electronically.
Nice. So let's get back to, so tell us about your background and where'd you go to school and a little bit what made you decide to become a doctor.
Okay, well,
yeah.
I went to school at Howard University,
Nice.
up in Washington, D.C.
Yeah.
And as far as like how did I get into otolaryngology or ENT, I was in medical school and I loved everything. You know, I loved general surgery, I loved internal medicine, I loved pediatrics, and I was having a challenging time making a decision. And during one of my rotations, we actually got a chance to do ENT. And the doctor there was doing this like amazing surgery where they were cutting out like a cancer from a person's throat, which sounds, but then they reconstructed it with a part of their stomach, their duodenum. And it was just so interesting to me that I was like, wow, this is kind of challenging and it's really interesting. One of the things with ENT is that, one, like we seem to be happy people, but also like you can see adults, you can see children, you can do a blend of medicine where you're just like say following people for like, allergies or other chronic conditions, or you can just do surgery, so it blended everything that I was interested in medical school in the perfect format.
So it sounds like that was your pivotal moment where you're like, oh, this is what I want to do. And it's so funny because I speak to doctors and a lot of times they tell me they remember that pivotal moment where like, oh, this is what I want to do.
Yes. And then from medical school, I went on to residency in Texas. I went to the University of Texas Medical Branch in Galveston, Texas.
Oh, nice.
So that was amazing. Got a chance to learn with a lot of different attending physicians. And we also got a chance to rotate around to other locations. So I was able to do like surgery on the middle ear in Anchorage, Alaska, and do pediatric, otolaryngology surgery at Boston Children's, which is the pediatric branch of Harvard. So like we were able to get so many different influences in our training that helped me as a physician today.
That's amazing. So you have a lot of experience with kids, adults, and with the whole gamut
Everything
of people.
in between, yes.
That's good, because I was going to ask you what would be the demographic of the patients that come and see you at the practice. So it's everything From kids to adults?
You know, right now I'm focusing primarily on adults,
Okay.
typically 18 and over. We were seeing pediatrics, but I have another colleague who only sees pediatrics in this
Got it.
area, so we refer to him for that now.
Oh, okay. So, Dr. Wright, why would I see you? Like, what would present, or if I know somebody who's presenting with something, what would be, you know, the reason for me to recommend you? What's going on?
Well, for me, I have, you know, I'm a general otolaryngologist, but I also have a focused interest in allergy and rhinology. And
Okay.
rhinology stands for like the study of like anything with the nose. So typically if you have issues such as like nasal congestion, difficulty breathing through the nose because it feels blocked, sinus infections, allergies, postnasal drip that can lead to conditions like coughing or hoarseness, you know, that's typically like my go-to area. I do a lot of like sinus surgeries and like reconstructive procedures to help you to breathe better through your nose.
So how would I know, and you probably get this question a lot, but
Yeah.
how am I going to know, is this a sinus infection, or is this a cold, or what do I have going on, or I have to just see you and you'll know, but what would I do when I'm starting to think, like, what would start happening to me?
I mean, typically it can vary based off of the timing of it. I actually have a chapter in my book dedicated to this.
I did see something. I did see something. Yeah. So,
But
what would I?
to give a general overview,
Yeah.
though, it's like, you know, sometimes these things can overlap. So you can have, say, a sensitivity to different environmental allergens, like say dust. You know,
Yeah.
so you're allergic to dust, which makes you a little stuffy whenever you know, a little bit every day, like year round.
Right.
And so that makes you predisposed to, you know, having blockage in your nose. And then you go and you get exposed to a virus, and that can lead to a cold. And typically a cold gets better within about a week or so, you know,
Okay.
7 days.
Yeah.
But if it's like stretching out, where it's like over 7 days, like 7 to 10 days, and you still have symptoms or they're getting worse,
Right.
then that viral infection may be leading into a bacterial infection, which causes a sinus, you know,
I
infection.
see.
And symptoms for that can be pain in your teeth,
Yeah.
you know, headaches, you
Yeah.
know, pain at the top of your head. People don't always
Right.
realize, like, headaches at the top of your head can be a sign of the back sinus. We call that the sphenoid sinus, but yeah.
So does that mean that the lymph nodes are not draining, or does it have anything to do with lymph nodes? Because I remember I knew somebody once who was telling me they had problems with the drainage of the lymph nodes.
Well, you have lymph nodes over your entire body. They
Right.
are in the face, they're in the glands and so forth. And they could be functioning perfectly well.
Right.
But they can get enlarged when you have an infection.
I see.
Because they're trying to drain away, you know, the area of where the infection is.
Got it.
So sometimes if those lymph nodes get clogged, let's say they're trying to drain out a bacterial infection and it gets stuck in there,
Right.
that can make them back up or get clogged, and it makes them get larger.
I see.
And that can lead to things like abscesses.
Oof.
Yeah.
So when I go to your office, would I get? How does it work with the test? I'm sure you do the allergy testing. How do you do that, and how does that work? Is it blood? Is it skin? What do you do?
Well, typically, so say if you were to come to my office, so we wouldn't just start out with a test. So we would do our full evaluation of you. So we would start by getting a full history to kind of figure out, do you even have the symptoms that will make us suspicious that you have an allergen? So we ask a lot of questions.
Okay.
And then we do our basic physical exam, and that involves like looking in your ears, your nose, your throat, looking for signs like congestion in your nose, looking for irritation in your throat. We call it cobblestoning, which can be a sign of postnasal drip. And just doing a full ENT evaluation. And then if we're not sure if we see everything that we want to, we may look with a camera called an endoscope.
Okay.
And that allows us to look a little deeper in your nose to see if there's anything like a polyp that could be blocking the sinus passageway,
Right.
or just some actual drainage that we can culture. And based off of the physical exam and your history, then we'll decide if you need to get a test.
Understood.
Yeah.
Understood. I know that it's like all on social media now. Everybody's aware of mouth breathing. Oh my God, you have to breathe through your nose, and like people are taping their mouth, and it's like it's the awareness is really, people are aware. So what would you say to people who suspect that they are at nighttime, they're sleeping and they're mouth breathers? What is your suggestion?
I mean, typically for us with ENT, I mean, I've heard of the mouth breathing as well, and taping the mouth closed.
Right.
I would recommend being evaluated.
Sure, of course, absolutely.
And I mean, there's some simple things that people can try. I mean, many times you may be a mouth breather because you're not breathing well through your nose.
Right.
So if we can get you to breathe better through your nose, then that's the first step. So you can do over-the-counter things, trying a saltwater spray,
I've heard of those.
Yeah, saline spray, help to kind of clean the nose. I call the nose a filter, and so you just have to try and clean out that filter so that it can kind of filter out things effectively. And so that's the first step. There's no medication involved. There's very no risk typically with using that. Next steps may be using some type of nasal sprays that are over the counter, like a nasal steroid spray. Some commonly known ones are like Flonase or fluticasone. So you can use something like that, which helps to open up the nasal cavity by decreasing congestion.
I see.
So those are two quick, easy steps that you can try. And if that helps, then potentially that can give you some relief.
Now, do some people have, people who you suspect have sleep apnea, do they see you or are they,
Yes.
How does that work?
Typically, if a patient comes in and, say if they sleep with a partner and they're told, hey, you stop breathing at night, we would then want to order a special test called a sleep study, which can now be done at home.
Really?
Yes.
I didn't know that.
Yes, very convenient.
How exciting is that? Because people don't want to go
to the sleep lab, right, and sleep in not their own bed, and it's
Sure.
not very comfortable, and they don't get really restful sleep. So now you can take home a home study.
It monitors you?
It monitors you. You typically keep it for a couple nights, and then you turn it back in, and then we can look to see whether or not you actually have an elevation of this reading called the apnea-hypopnea index. So apnea is when you hold your breath for 10 seconds. Hypopnea is when you're breathing, but it's really shallow and it's not enough to really kind of support the kind of oxygen needs that you have.
Yeah.
And the reason why that's super important is because you can not be breathing well through your nose, which can lead to things like obstruction. That can lead to sleep apnea, and untreated, we find that it can increase the risk for conditions like heart disease, heart attacks, and even strokes.
Wow. And I don't think somebody would be well rested the next day, I would imagine, if they're not breathing correctly. I mean, they must feel fatigued and tired. I'm guessing, I don't know.
Many times people are definitely having daytime fatigue and they feel tired, but not always. I've diagnosed a number of patients who they snore, but they don't feel like it's a big deal, you know?
Right.
And it might not be. It may just be sleep disordered breathing, as we call it, and you're just snoring, and it's annoying for your partner, but it's
Right.
not a big deal. But there are times when you think you're fully rested, and you're not, and you're not getting that oxygen that you need. So with that test, it helps to really differentiate that. But being tired during the day is definitely one of the key points that we look for a patient with sleep apnea as well. Very solid point.
So let me ask you, Dr. Wright, what about COVID and the after effects? Have you had have a lot of patients come back maybe complaining, oh, I'm not smelling the same, or something's wrong? Please tell us your experience that you've had with your patients.
Yes, I mean, with COVID, we have had patients who have had issues with prolonged, either anosmia, which is when you can't smell at all.
Oh, I've heard that. I've heard people tell me that.
And we don't completely understand the post-COVID anosmia. Some people get their sense of smell back within 2 weeks, which is amazing. Some people, it takes months, even a year or so, and then they may get some of their sensation back.
Wow.
There are some therapies that we have utilized. It's called smell retraining therapy.
Oh, interesting.
And that's what's involved with that. Typically is you smell 4 different scents. So it could be eucalyptus, lemon, clove, rose, and you're smelling it for 20 seconds, a piece, for about twice a day. And you're also maybe looking at a picture of a rose, and you're
retraining the brain.
Yes,
Oh,
you're trying to retrain your brain. Remember what that rose smells like? you know,
That's
remember what that
interesting.
smells like, and that sometimes can help to improve
Yeah,
that.
it's kind of like, it's like a memory slash. Well, they do say that memory and scent. Well, I've experienced it. I'm sure everybody has, like
Yeah.
smelling something, and I'm like, oh my God, my second grade teacher wore that
Yes.
perfume. Like it just
Yes.
the memory, right? So, yeah, makes a lot of sense. So there's so much valuable information. I love the way you wrote the book because you really wrote it in a style that for me it's great because it's like you highlighted it, you put it into sections, you broke it down like dermatitis or signs of allergies, inflammation, like different chapters have, you know, and you wrote it in a format that's like bullet points. And so I thank you for that because it really is, it's an informative book, and you really want your patients to, you know, look at it and to be able to go exactly where they need to go. But we're going to take a quick commercial break. When we come back, we're going to touch more on the book, and we'll take it from there. Quick break, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in. And we have Dr. Camysha Wright, and she's right here. She's an ENT specialist right here in Plantation, 201 Northwest 82nd Avenue, Suite 404. Zip code is 33324. Her phone number is 954-368-8519. If you know anybody with allergies or anybody with any of these concerns, please check out her website, www.theright, W-R-I-G-H-T, therightENT.com. So I'm really loving, like I was saying, I'm loving the book. I'm loving how you really broke it down into segments because people want to know, they want information, they want it now. You know, it's like, oh, here's what I have. So like inflammatory, 5 inflammatory sources. Can we talk about maybe inflammatory people who come in with issues, and how would you know it's an inflammatory issue?
I mean, there's so many issues that are like caused by inflammation. Allergies is just one of the conditions, sinusitis. You know, we know that inflammation plays a key factor in so many different conditions. One of the things, like, you know, being an otolaryngologist and having a focused interest in allergy, it started just my research in that field, and the more I study it, the more I learn about how it's so interrelated with other areas of the body. one of the key things in my book is how the nose and the airway itself is all like a unified airway.
Oh, yeah. Let's talk about that, because that's the title of the book, An Overview of Allergies and the Unified Airway. So please explain to us, what is the unified airway?
So the thought behind that is that, if you breathe through your nose, and if you have an issue with your nose, it can also affect like your windpipe as well as your lungs and so forth. And we can see how that can be affected directly. If you have like a mucus or infection in your nose and it drips down, you can cough and it can go into your airway. So that's one direct form. But we've also noticed that just by having inflammation in your nose, even if it doesn't directly cause like, a drip down into your chest, you can still have inflammation in your chest. People with allergies have a higher risk for other inflammatory conditions like asthma, which can be pretty severe and dangerous, even leading to death for some people. So we always want to try and remember that. I tell people that we really want you to kind of breathe well through your nose, because that helps you to stay in like a relaxed, like more parasympathetic, relaxed framework, versus the sympathetic, where you're like that fight or flight, run from the lion type thing. When you're breathing through your nose, you're at ease. You know that, okay, life is good. I don't need that extra air, to try and like escape from that enemy or that thing that's trying to attack me. And it really helps to decrease that nervous system, so that hopefully you can have less inflammation in your body as well.
Yeah, so true. I mean, even just meditating for me, even just focusing on my breath and doing the deep breathing when if something's going on in my life and I'm a little stressed, I'm like, okay, I get to do the deep breathing, and it really makes a difference. The deep breathing, people underestimate the value of the deep breathing.
Yes.
It's so powerful.
If nothing more, like, how you were talking about meditating.
Yeah.
I mean, like, one of the key things that when you're first starting to meditate, they're like, well, if you can't stay in the present moment, focus on your breath.
That's right.
Right?
That's right.
Because when you're focusing on your breath, you're forcing yourself to stay in the present, because you're breathing in and you're breathing out. And so we want to make sure that when you're doing these basic things, like you're trying to relax and try and get your center, that you can do that, right? If you can't breathe through your nose, then you're just going to be stressed that whole time. So we really want to kind of focus on ways of trying to get your body to get back to its physiologic norm and baseline.
Yeah, and it's really, I think a lot more people are more aware of it. There's a lot of I'm seeing a lot more breath work classes.
Yes.
I'm seeing a lot more people really taking advantage of it's free. We just get to, learn how to fine tune it, Yeah. So people can get inflammation, I guess, if they have allergens, pollen, dust mites, pet dander, et cetera, all those things and more cause inflammation, right?
Yes.
Oh, mold is a big thing.
Mold, especially down here
in
Florida.
Let's talk about that.
I mean, so typically, like with mold, if you live in a warm, humid environment, which is pretty much all of South Florida, you have a higher risk for being exposed to mold. Mold can be both an allergen, like an allergic trigger, but can also be a toxin.
Yes.
So you don't always have to be just allergic to mold, but if you get toxic exposures, you can still get sick from it. In my practice, we see both, but we typically try and treat for the allergic triggers. So if you are breathing in, say, a certain thing that your body recognizes as being foreign, then I tell people it's like you breathe in the mold and it goes into your nose and it hits one of the little, allergy cells in your body, and they link up and they bind.
Right.
And that's not a big deal, except that the allergy cell gets upset and it kind of like explodes. And when it explodes, it releases all of these chemical mediators, and that's what's causing all the problems. So you get, congestion and postnasal drip from histamine and things like that. Wow. So we're trying to actually, decrease exposure to things like that by using immunotherapy. You can do things like having a dehumidifier, in your home to try and take some of that moisture out.
A good idea. People who live in Florida, and if it's damp, dehumidifier will help.
Yes.
Sure. Yeah.
And okay.
I was going to say we have 3 minutes left, if you can believe how quickly this has gone. So just to kind of wrap it up, maybe we can talk really quickly, because I saw on here about the microbiome. So maybe we can talk quickly about that, and then any last take homes for anybody who's listening.
Yeah, I always kind of talk to like my colleagues, my patients and so forth about how important like gut health is. I mean, just in general for decreasing inflammation, there's so many inflammatory foods that can cause like triggers, sugar, you know, for some people like things like gluten, even dairy can be some common triggers. But just having like a healthy bacterial like environment and not a leaky gut, you know, can decrease the risk for having like allergic triggers and having like symptoms from that. Typically, I feel that with that, you know, with allergens and with the gut, considering things like probiotics, maybe something to try and keep like that gut system normalized.
Right.
And there's research, you know, pro and against that, but I think that it's definitely helpful.
Yeah, it always comes back to the gut. I mean, even when I talk to doctors about brain stuff, it's always like gut related. It's amazing how our gut is so powerful. We have like a minute left. Any takeaways you want to shout out to the audience, and just maybe, or a quick story about somebody who had a success story maybe, or whatever you'd like to share with our audience.
It was funny, we were talking about, it's an off topic, but we were talking about like decreased sense of smell, and I actually had a patient of mine who had a decreased sense of smell pre-COVID.
Okay.
And I also had a lot of allergens, and so we treated that person, and then successfully they actually got their sense of smell back.
That's
so
amazing.
that is one other cause that people don't
there's
think
hope.
about.
There's hope.
Yes, for that.
There's hope. Well, everybody, thank you so much for tuning in. You can get Dr. Camysha Wright's book on Amazon. It's called Breathe Easy, an overview of allergies and the unified airway. And you can always reach out to her directly, 954-368-8519. Thank you for tuning in, and we will see you next week. Take care.